Good morning. It's, as you see, I'm hobbling this morning. So I hope all of you are getting along better than me, but I have severe sciatica, and if it hadn't been because this was Kevin, I would be in Little Rock this morning. Yeah, and so I've had to use wheelchairs and friends and shoulders and everything else to get here, but I'm here. So no excuses. And he told me to just, I'm just going to introduce the Congress, and all of you know that this has been a wonderful, at least I've felt, just been a wonderful conference. Each year, I think, well, he can't outdo himself in getting better speakers, and somehow he manages to find a way to do that. So, and I've enjoyed everyone, and I've always taken away, had something that I could take away. And it's not many organizations around the country that are concerned about patient safety and patient care. And you know, none of us like to be very transparent. So I think that this is what's been stressed about this conference. This is the thing I have really enjoyed about this conference, and felt there was just a very good thing about it. We all know that our main job, it's what we want to do, all of us, is to protect our patients. You know, we want them to be safe. If we weren't there, we wouldn't be out there doctoring and trying to make them better. And we certainly want to make sure that we do no harm. But sometimes we do. We're human beings. And so we want to protect our patients from injury, our errors. We're saying, well, we don't make medical errors. Well, we know that's a lie. So we don't go out deliberately. No, if you go out and deliberately do it, that's not an error. You know, when you do something deliberate, that's not an error. But we try not make medical errors, but there is no such thing as a hospital in this country that's never had a medical error. So, but we try to reduce them as much as we possibly can. We try to protect our patients from injury, protect them, keep them safe, and to always make sure we don't do anything that's going to hurt them. There are significant problems in the United States. Medical errors related to injury, accidents, and Kevin always makes sure that we're aware that we cause many infections that create a long problem. And I will never forget the chilling but wonderful patient story about medical errors that happen in one of the best hospitals in this country. So we all know that they happen. And we try, and some of our patients, we old folk, you know, we go into hospitals, we've been accustomed to everything being right here, and we reach for it right there, and we lose our balance, and we have an accident and break our leg. We didn't mean to, but it's said that many of the patients we're old Medicare patients. 25% of us will have an accident in the hospital. And of course, many patients get infections. More than 440,000 people every year, die from our errors. Not that we mean to make them. And a fourth of our Medicare patients have problems. So let's get on and talk about it and admit that they're there. So our aim is to increase patient safety and get to zero harm. To prevent harm and have a safety culture, a culture of safety. We have to have a culture of open reporting. And you know, many of our hospitals, we don't do that. We often, we make an error. Hospitals all along often hide that. And we're finding out that we really are open and tell our patients, talk and not blame whoever. You go around blaming. That's what we do very often. An error is made and we spend the time blaming. But we have a just culture, an open culture, and then we learn from it and tell our patients what we learned and what we're going to do. If we don't admit we have a problem, we won't fix it. There is no point in thinking you're going to go around fixing something that you won't even admit you've got. Some of the keys to safety, we have to learn to collaborate with each other. Collaborate and talk. We don't communicate. Often that happens. We're not very transparent. And we're certainly not consistent in what we do. When we think of transparency, when we have to be open and honest about what's going on. And we have to have problems and develop problems and policies to fix those problems. If we don't do that, we won't fix them. In order to be transparent, we have to have early learning. We have to start out learning what the problem is and how we're going to fix it. And if somebody else has a good idea, it's all right to steal it and share it. You know, somebody has a good idea, we don't have to walk around and say, well, I didn't get it from them. That's all right, just steal it and share it, and let's pass it around if it's good, so everybody can share in that idea. We have to work as partners. The doctors, the nurses, the hospital administrators, the people that clean the floors. We have to start at the top and go to the bottom if we're going to really be transparent. We have to have some mentors. You know, if you've learned good things and know them, we have to pass them along. We can't rise up and get to the top. We have to send the elevator back down for those at the bottom. You know, we often have the nurses come in, they know they're good nurses, but they don't pass it on to the new nurses sometimes that's coming in. And I know nurses don't do that, but doctors sometimes do. So we have to pass it along. We have to all be teachers, all be learners. This is, I'm not going to read all of this. Y'all can read, but we know that this is the 10 recommendations from the safety learning group, and they had more than 100 recommendations. And this is Becker's 2017 recommendations for how to increase transparency and improve patient safety. First, the thing he said, we have to start with the board of the hospital, and be involved. And they have to be a part of the culture of learning and transparency. You know, many times boards keep their board membership a secret. But we have to be transparent regarding who's on the board and the members of the board. Major of the healthcare organizations, we've got to be able to depend on the data they get. But the data in is that you get out is no better than the data you send in. If you send in scut, you're going to get out scut. So, and you're going to hear, and that's true in research. But data in, data out. Whatever you put in, you're going to put out. But and it's got to be accessible, not only to the patient and to the public. Executives and clinicians should provide descriptions of where they could get alternative tests better. Not every hospital should feel that we are the only place that can provide the good test for money. If there's another place that, you know, we had mammograms for a while when they first came in, everybody was setting up to do mammograms. Some of them weren't worth the time you spent. But we should report that and have it known. We need to tell our patients about the tests we're going to do and about why we're doing them and what they mean. Very often you get a whole long list of tests. Now your test costs about 5 times more than your doctor visit. You get a list of tests back, and you don't know what they mean, and oftentimes the doctor don't glance at them and don't ever tell you what they mean. You should demand while they're getting them what they mean. We, as patients, have to demand more. I was telling someone last night about my doctor coming in, spending the whole time on my visit, looking, getting the records straight, creating e-records. I like e-records, and I think they're wonderful, and they make for better records. They don't make for better interaction with the patient. She spent the whole time, and she never looked at me. Finally, I said, Doctor, you're going to have to do your records some other time when you aren't seeing me. Because, well, what I'm saying is, I want them to have good records. I think we have to promote and push good e-records. But they need to spend 5 minutes looking at you, and when they're asking you, how are you feeling today, and putting down good over here or horrible, well, at least glance over and see if I look good or if I'm frowning. So, these are things that we've got to do. And if we have an accident in the hospital, we need to let the doctors, the patients, the nurses, everybody know about it, and the patient's family, and tell them that this was an accident. This was what we're going to do to fix it, and they're far less likely to sue you if you really talk with them and explain it to them if you weren't careless and meant well. Patients know when we don't mean well. If we find somebody who's doing things that we know are not right, we need to report that. We tend not to. First, we can go and we can talk with the clinician or whomever we see doing it, but we know it's not right. If you see a nurse, or doctor, or whomever, not washing their hands, we should say, well, doctor, you didn't wash your hands. Or, most of them, I say, will appreciate that and say, thank you, and go over and wash them. But we have a few of that other kind. And so those are the ones we're talking about, that we need to make sure we report that disruptive behavior. And we should have accountability standards to deal with that. We don't want people going around getting mad at somebody and giving a bad report. We have to have mechanisms for best safety practices from one clinician to another. The reason why we have checklists, we often feel, well, we don't need checklists. It's okay. We need checklists. So we need to make sure we have the checklist. To improve transparency with public, regulators, and payers should ensure that all health care entities have core competencies to accurately understand and communicate their performances. And we, as clinicians, nurses, hospitals, regulators, payers, should be sure healthcare organizations publicly display the measures they use for monitoring quality. Very often we have people monitoring quality, and we don't have any standard by which to judge that and you go by. So for safety behaviors, we have to have early prevention training, high reliability. We have to accept that human errors and medical errors are what they say they are. Respond quickly, timely, have a standardized way of doing it, and we got to be optimistic. So we're going to be transparent. We've got to admit it. You can't fix what you won't admit. We've got to reach out, and we've got to each be responsible, not only for what others do, but for what we do. You've got to be aware of the problems and develop an action plan to prevent those problems. We've got to be aware of the adverse events. We've got to learn to network and navigate the system. We have to have patient navigators. Many times we don't. Patients don't even know what's going on, what to do. And we've got to think solutions to problems. If we're dealing with problems, think how to fix it. Not just, we can all sit down and list a whole long list of problems. But we say, well, how do we fix that? Many times we get silent. We have to learn how to be successful with it. Always consider patient safety, make what we do patient-centered, and they're satisfied. Nothing is better than a satisfied patient. We've got to focus on prevention. We know we're the best doctors in the world. We got the best treatments. We got the best hospitals. But we don't have the best health. That's because we don't focus on prevention. We've got to be patient advocates. Not just say we're patient advocates, be real patient advocates. And you're going to hear a lot about research integrity today, and you're going to learn that everything you read on the internet or and the best of journals and all is not necessarily 100% true. We've got to make sure that we accept and deal with it and learn how to interpret that data, and you're going to learn more about how we do that. We've got to educate and empower ourselves and our patients. And you've heard me say something about e-charts today. Well, I love e-charts. Don't feel but I'm just saying I want my doctor to look at me every once in a while. So we've got to be competent, and we've got to deal with change. And in order to be competent, committed, and deal with change, we've got to be willing to commit our time, our talent, and go down in our pocketbook and deal with our treasures. Many of you may have had to pay a little bit to come to this meeting, but you came because you wanted to learn about what was new and what was changing. And I want you to know, transparency and change depends on you. And always remember that a society grows great when old men and old women plant trees under whose shade they know they'll never sit. And you're planting trees today where you know you'll never sit. And we don't change our direction. This is an old Chinese proverb. We may end up where we're headed. Thank you very much.